James, are you here yet? There's a guest user and then there's somebody else on here that I can't see their name, so I just want to make sure you're not here. Okay, we'll wait just a few more minutes. Okay, Olivia and James just said that their Zoom is opening just a little slowly. So we'll just give them a couple more minutes. Thanks again for being here. Hopefully this will be super informative and something to take away for your tenants. Um, I will be back in just a few minutes.
Hello.
Hi.
Hi guys. Thanks for being here.
Oh,
Of
absolutely.
course.
Okay, so I think we're good. We've got a few people on here now. A lot of people tend to trickle in a little late. So we'll just let that happen. And then let's get rocking and rolling. Just to let you guys know, this is being recorded
Okay.
too, and we normally send this out to our landlords, property managers, and owners whenever I can kind of get it organized by the end of the day.
Awesome.
Okay, so let me introduce you. So, to everybody, Olivia Cook and then James Greer. Olivia is the Assistant Director of Community-Based Care Management. And then James, hold on, hold on, hold on, hold on. Oh my God, come on. I literally just had it. James, what's your title?
Program administrator.
Thank you. So these two, I think I have oh, there we go. Program administrator of the community-based care management team.
Yeah.
I had to scroll up a little bit in my email. Olivia and James, if you guys could just kind of give us an overview of the program and then give us some details about resources and things that would be helpful to our landlords that they can give back to their tenants. And maybe, we'll take questions, of course, but if there are any, hopefully there will be. But maybe just kind of describe the type of work that you do specifically for the tenants and how it kind of relates to the housing authority, which would be super helpful.
Yeah. Hannah, we actually have a PowerPoint that James put together. Do you care if I start sharing it?
Not at all.
Okay. Hold on one second. And then I can just control it.
Totally. Oh,
Okay.
yeah, yeah, yeah. Of course.
Let me see. Okay. Can everybody see the PowerPoint?
Yes.
Okay. I'm gonna start from the beginning. All right. So I'm gonna pull this a little closer to James.
Hi, everybody. Yes, so thank you, Hannah, for the introductions. Yes, we're with community-based care management, part of Allegheny County Housing Authority. Next slide.
If it will work.
Yeah, that's okay.
There we go.
So what is our program? We've been around for about 2 years. We act as a case management arm for Allegheny County Housing Authority. We work with all residents of ACHA, primarily in the low-income public housing properties. Sometimes for like extenuating circumstances or complex cases, we do take on Section 8 clients as well. Our main process is going out and doing an assessment with a client once they're referred to us. We do an assessment, asking a bunch of questions on what their needs are, letting them know like kind of the expectations of the program, and then we follow that up with biweekly home visits and ongoing support plans. So support plans are usually composed of taking those needs that we identify in the assessment and turning those into goals and what the strategies can be to achieve those goals, a collaborative effort between the program coordinator and the household. A big thing that we do is resource linkage. So, when we assess a client, we notice gaps in service, we notice gaps in things that they might be interested in getting help with, and we do our best to connect them to those resources that are appropriate. Our assessments our approach at large is a strengths-based approach. So anybody that maybe is not familiar, strengths-based means that we play to the attributes of a client. Like what are the clients good at? What relationships do they have? What knowledge that they have? Really, really encouraging clients to utilize those as they attain a more self-sustaining life in their housing. We also take a trauma-informed approach. We talk, trauma-based care is a term that we use that you probably have heard a lot. It basically means that when we work with somebody, we care about, there's an approach. A lot of times we deal with folks that deal with trauma. A lot of times people say like, what is wrong with you? We come from the approach of what has happened to you. Mm-hmm. So we always come from a place of non-judgment with the support of the individuals that we serve. So next one, please.
And I would like to say that we would love to start taking on more and more Section 8 clients. And we're hoping in 2026 to expand our team so we can take on more of that capacity. And you guys will definitely be the first to know once we start taking on more.
Our assessment is based on a concepts called social determinants of health. So social determinants of health are basically all the things in somebody's life that when properly addressed, increases their chances of having a better life of self-sustainability, security, happiness. These determinants vary, and they can be more tangible things such as access to food, access to transportation, to other things such as access to an income that allows them to pay their expenses, as well as access to health care, both physical and mental health care, a sense of safety, a sense of community, because all of these things, as you know, these are things that sometimes we take for granted in our day-to-day that we have access to that ensure that we are happy and healthy. But sometimes a gap in one of those things can cause a lot of issues. And as you can imagine, you can actually go to the next slide. As you can imagine, a lot of these things, the gaps can be, the needs can be interconnected. So somebody, might have access to, an ability to pay for food, such as SNAP, but maybe transportation is a barrier, so that prevents them from getting to a location where they can use their SNAP benefits. So transportation now affects other, as well as maybe transportation is an issue getting to the doctor. So you're seeing how one gap in a need can affect other and create other gaps in need. And we identify those needs, and as I had said before, we create support plans to then try to create a step-by-step process so that a client can plan how to get connected to those resources and things that they can do for themselves. Next. So we are a relatively new program. We've only been around for 2 years, but in the last year, we have expanded trifold. We have 2 other programs in with us. There is the Health Navigation Program that is based on a grant and a collaboration with UPMC. We work with ACH residents and getting them connected with their healthcare providers. The idea being that healthy people stay housed, people that have access to healthcare resources, that
Staying up to date on
doctors, appointments, having access to medication. Those are the things that can really help somebody stay where they are living and be self-sustaining. The third program we have is called the Tenancy Sustaining Support Program. This is a collaboration that we have with Allegheny County Department of Human Services. So I'm sure a lot of people have seen in the news in the past year and a half, there's been the 500 and 500 initiative. So placing 500 households that are experiencing homelessness into 500 affordable units in 500 days. We've exceeded those 500 days, but they have reached that goal of 500 households. Our team acts as a follow-up case management service to any of those individuals that have been referred to us to support them or find supports for them as they transition into their new housing, and we work with them for up to a year as they're in their new housing. So as far as referrals go, we have 3 different avenues for referrals for each of our programs. For CBCM, our referrals are self-referrals. They come from property managers. They come from other community-based organizations. They can come from ACHA police. And health navigation, we get our referrals directly from UPMC. And TSS, we get our referrals directly from DHS. I think that's it. Yep. So that's it. Thank you all for your time. I appreciate it.
Awesome. I think that it, is a point that this is pretty short and sweet, right? These tenants really need some help, right? A lot of them really need some assistance. And I love that you guys take that approach of what has happened to you rather than what is wrong with you, right? I think that that's important. And I think for our landlords, it's hard because, landlording is a business, right? Having property is a business. So it's hard to kind of separate ourselves from the business aspect into this aspect of making sure that the tenants are taken care of and seeing what we can do to kind of help them a little bit more, right? Okay. Does anybody have any questions?
Me, hello.
Oh, go ahead.
Hi.
Was there
Matt.
another hand up? Because I was just eager to get in there. Sorry.
No. Go ahead. Yeah, go ahead.
Okay. Hi, I'm Maddie. I do resident service coordination for an affordable high-rise, private pay and housing choice vouchers. And it's a LIHTC building, so the service requirements are very low, and we're often trying to partner with organizations to give more support to our tenants. So I've been following this and trying to learn more about it. So right now, so we have pretty good relationships, but often if we see tenants at risk for eviction, we can give resources, we could do warm connections, but we often see there's an extra layer of support needed, in like more intensive service coordination, and they might not line up exactly with programs where you can find that. Could I refer to this program, like whether it's the DHS care management, or like, is there a pathway where I could start referring tenants to this for support, particularly households that are at risk of eviction?
Yes, that's a great question. So to be referred to the Tenancy Sustaining Support Program, all of those come from DHS. So all of those referrals are individuals who are coming from shelter, and then they're moving into either ACHA properties or private properties.
Other subsidized like HACP or Brandywine or what have you.
Or Westmoreland. Yeah. So you wouldn't be able to refer for the tenancy sustaining support program, but you could refer to the community-based care program.
Okay.
And what that would look like is I can share the I mean, Hannah actually makes our referral forms,
Okay.
so she has them. But I can always send them out, and then I can also send out a resource guide for Hannah to blast out to all you guys as well. I will say we are at capacity for CBCM currently. We only have 4 full-time staff for community, or I'm sorry, for CBCM. So all of them have about a caseload of 25 people. So right now we have a little bit of a pause on who we're taking referrals from, but it doesn't hurt to send over any complex cases that you might have. And then I can either point you in the right direction to see if there's another third party entity that you guys can go through, or if we can take them on as a client, I will respond right away to you guys and let you know I can get them assigned to a caseworker.
Well, thanks. And how many staff are in the tenancy supporting that arm?
We have 7 tenancy sustaining support
Okay.
coordinators, 2 health navigators through our UPMC health plan, and then we have 4 CBCM program coordinators. And we're hoping to expand just because the need's there, right? And the housing authority is expanding as well. So we want to be able to provide as many services as we possibly can. But with only 4 coordinators, it's a little bit hard.
Yeah. Okay. Thank you.
Yeah.
Yep. Thanks for your question, Maddie. Okay, guest user. I don't know who this is. You have your hand up though.
My name's Shannon Miller. I'm sorry. I'm not sure why it always makes me guest user.
That's okay. No worries. No worries at all.
So I guess my question is, and it kind of was answered, if you are taking on new people. By the way, I do prefer to be referred to as a housing provider. I identify as housing provider, not a landlord.
Okay.
And I think that we would all do well to change that terminology. So I guess the answer is that on a case by case, you're taking on new clients, but not necessarily new ones. I do have a particular individual in mind who is very close to being evicted. The eviction is based more on decisions that they're making, too many cats in the house and not cleaning up after themselves. But that I do feel that they could benefit from this. But I think my question was kind of answered there in that.
Yeah, if you guys, I do want to invite you guys as well. If you ever have a complex case and you're not really sure where to turn, you can always email me or call me. I can put my number in the chat, and I can point you in the right direction.
Liv, I'm gonna put, you can do that still, but I have
Okay.
our follow-up email template already that has both of your contact information.
Perfect.
So we'll do that too. But yeah.
Awesome. Great.
Any other questions? So I think to kind of just sum up things so far, right? It never hurts, right? Because we all network. Everybody knows we love networking. This is a great way to do it, right? The housing authority, wants that to happen more. So if you guys do have, I think I told Olivia last week, I know you guys will have tenants in mind already. It never hurts to reach out to Olivia and James and the rest of the team because they most likely will have the networking capabilities that we need in order to help these tenants out. So I do think that that's something that should be stated just one more time. Definitely never hesitate to do that, right? And I hope I'm not speaking for you.
What I was going to say is if anybody on this call has a case that they want to go over, and they don't have to share that tenant's name, but they could just tell us a little bit about what's going on, we can kind of problem solve and figure out how we would tackle it. So if you want to use that time to do that, we could totally.
I love that idea. I think that's a great idea. Maddie, do you have anybody in mind, particularly?
My say sorry, I'm connecting to Bluetooth. I think sometimes I just hope they're secretly trying to move out. Like we have workforce services in the building. So if you need to change jobs, I know it's not as easy as that. Um, but if someone's just not paying their rent and have a child in the home, and we're giving the resources, we're reminding workforce is there to help with job change. Um, they have already used their one time housing stabilization fund chunk, whatever the big one is, and they're just not paying. And you're like, I'm watching this go this direction. Um, yeah, that a case like that, I guess. And you're like, maybe you're usually tenants like that are already planning to move and they're just trying to save. So they're not engaging, is what I've seen in the past. But you also don't want to gamble especially when there's a kid in the home. So yeah, so I guess if I'm giving a paper of like, all right, just so you know, this is the one place you should call or one thing you should do, regardless, just to make sure your housing stays consistent. Um, yeah, just don't want
So
to.
for our low income public housing clients that are not paying rent, so typically we would go a couple different routes depending on the situation. Um, Auberly has a what's called a FAIR program, and they will actually come up with the funds to help the tenant. But there is very specific criteria, and I can share that with Hannah to send out to you all because that could definitely be a beneficial resource. Um, and then trying to think, Just Mediation Pittsburgh, we use a lot. I'm not sure if anybody on this call, I know Jennifer Beresford is familiar with Just Mediation Pittsburgh, but I'm not sure
In
if
this
anyone.
case, I think it's already been used.
Okay, okay. Yeah, so like you said, that it gets tough when they've already used those funds. And something that we talk about a lot is natural consequences, right? If there's a difference between behaviors and there's a difference between mental health. If someone doesn't have the capacity to understand, maybe for whatever reason, their depressive symptoms or anxiety symptoms are getting the best of them and paying rent, they see this large number and it's just getting to them and they become avoidant and they're not doing what they need to be doing. That's one thing. It's also another thing is maybe that person has some paranoia and is struggling and doesn't want to provide money to all of a sudden the housing provider is I don't know, Satan or the devil or something like that. That would be definitely a more complex mental health case. But when it comes to people just not paying rent and doing what they need to do, and they have been giving multiple tries in support, sometimes a natural consequence is needed to change that behavior. So we try to encourage natural consequences as much as possible.
Does that help, Maddie?
Yes, thank you.
Cool. I have an example of one. I'll try to sum this up as quickly as possible. But so she's a Section 8 tenant. This happened just a few weeks ago, actually. It was at the end of the day. And staff, everybody here the front desk was closed. There were actually just a few of us left in the building. And I was talking to a coworker literally out in the parking lot, and an Uber pulled up. A mom and three children got out of the car. You could tell, things were disheveled, right? Bags were full. That you could tell that she had just vacated her property. She also did not have the youngest child was in a car seat, but was not properly strapped in the car, things like that. That's important for later on in the story. Um, so the coworker who I was talking to, we talked to her. The mom did seem like she was completely out of sorts. She was complaining that she was hearing things inside her apartment, um, that her family members were, following her. There was some stuff going on with some relatives and the children. Very unfortunate. So of course we bring her inside. We get them some water. We get them some food, snacks, and things like that. Um, and so what we did, we called our PD, right? Nobody was here. Oddly enough, the entire police force was up in Pleasant Ridge taking care of something going on up there. So there was no immediate way for us to get the assistance that we needed from the PD. So the mom was, again, super disheveled, and complaining that she couldn't get a hold of her landlord, right? Or a housing provider. So Shannon, I do actually really like that name change. Regardless. So we ended up staying with this tenant for upwards of 2 hours before the PD got to us. Like literally that's how long we were, an hour and 45 to 2 hours. The PD finally got here. In between the time of when that happened, that 2 hours or so, we were trying to call Ubers for this family, right? To get to a grandmother's house that was in, just up the road. An Uber came. The Uber said that they wouldn't take the children because there was no car seat. There like nothing could be attached in order for these children to safely ride in an Uber for legal purposes, right? Which is understandable. But that goes to show they were quite literally abandoned, right? Like if we had not been here, the two staff members, literally the last two staff members at 6 p.m. weren't here. They would have been sitting here not being able to get anywhere else.
Right.
So, obviously what I did after the PD got here, I came back, I was able to annotate things. And we were able it was also a Friday. So that was the other unfortunate thing was we literally couldn't, we couldn't get hold of anybody. So, I ended up annotating everything. It was fine. The housing coordinator was able to take care of things on Monday. We were able to figure out what was going on. But I guess I would just like to know what you guys would do for that tenant. Specifically, the landlord was not involved, quite literally not answering anybody's phone calls because I tried to call them, right, within that
Yeah.
2 hour span of us being here. So, luckily, we have these landlords here too. So hopefully you guys would be doing the opposite and you would be more involved and aware of the situation. But let's say the landlord isn't involved, or maybe go two different routes that way. If you could explain what we would do.
So I commend you for getting the natural supports involved, because that's definitely something that we would consider. Given that you said there's 3 children that were along with her. Yeah. Another option, you can call Resolve Crisis Services. They are the mental health crisis agency for Allegheny County. They never close. They are 24/7, 365 days a year. And what's nice about Resolve is that they have a phone center, which is connected to the 988 lifeline. So if you call 988, you're going to, based off your area code, if it's a 412 or if it's even 724, you would most likely get routed to Resolve. And then when you talk to the phone clinician, you can request a mobile team, or they can give you more information on the Resolve's walk-in center, which is over in like the Homewood Point Breeze area. Now, given that was McKees Rocks, Hannah, another option would be calling 911 and asking specifically for the A team. The A team was actually put in place to help alleviate a lot of the mental health calls that police get tied up on when there's more pressing, more lethal events going on that we need the police to respond to, and the mental health calls can go to the A team. The problem with, I shouldn't say the problem, but a barrier for the A team is that they're only in select areas, McKees Rocks being one of them, and they in order to generate a team to go out to a call, you have to call 911 and identify that there is a psychiatric crisis, and then they will be dispatched. But yeah, I would, because it was after hours at 6 p.m., nobody else is at Central, I would have probably suggest calling Resolve, asking for a mobile team to come out. What's nice about mobile teams is each of the vehicles have a car seat in them. And they're gonna, even if they can't do the transport, they're gonna be able to link that person with the proper transport, whether it's giving them bus tickets or calling a cab to get them to the next appropriate step.
Mm-hmm. Cool, that's good information. Thanks.
Yeah.
Any other, I like this idea of explaining some situation ships. Any other?
Hannah, did Olivia say the A team?
Yeah.
The A team.
Okay.
Yep.
Okay. Thank you. Just want to make sure I heard that right.
Yep.
Jackie, I was going to call on you next because I feel like you may have some instances where you've needed this to happen. Not to put you on the spot.
Yeah, there was one, but it was taken care of by the police.
Yeah.
Yeah. But it's good to know. I'm taking notes. I missed the first 15 minutes, so I have to watch the recording.
Yeah.
But yeah, none as of, but Arborlee, we found that Arborlee hasn't been responding to us, which is kind of strange because they're usually our go-to, when trying to help the tenants like with their move-in fee or whatever. So we find that odd. It could be related to the government shutdown or just I'm not sure, but we've noticed that they've just been unresponsive as of late.
We have seen an increase in like with community-based organizations where they're just at capacity. We can, as a community organization ourselves, we do our best to try to communicate where our backs are being up against the wall where we're put in little corners and we run into barriers. So
yeah. Okay.
I do have another question. Have you guys ever been involved in like when there's tenant to tenant issues that could possibly put either household at risk for eviction, like kind of like tenant to tenant mediation? Does that ever come into your caseload?
We definitely have had some cases. I'm not gonna lie, I don't love those cases. Just because we're coming at a standpoint where we're here to work with the individual. We're not here to mediate between two individuals. We're gonna try to link them to appropriate resources. Or if they need signed up for a therapist or med management, things like that, like we will absolutely tackle that. We won't be able to necessarily like communicate that with the other party because of HIPAA. Now I'm trying to think of the one that Zamir is working with. She's working with one client, but there's definitely a feud between two other residents. I guess with the additional support that we're providing to the resident, there might be a decrease in conflict. Instead of them going after another resident, maybe they're taking time out of their day to call James to vent their frustrations to him instead of taking it out on their neighbor. So there's like indirect ways that we can help.
Yes. Okay, and then sorry, one more. Kind of relatedly, do you have any success stories? I feel like a lot of like trauma history or unaddressed mental health like getting in the way of tenancy, but we all know you can't make someone use supportive or mental health services. Do you guys have any success stories of like engaging in a situation like that where maybe there's a history of trauma or unaddressed mental health where you guys have had like a partner be able to like a referral be successful? Like, yes, when we work with this mental health agency, they're really good at follow-up or meeting a person where they're at. Like any examples of referrals that have been really successful with that area, like supports for mental health or trauma?
Yeah, I would say. Do you want to talk about one?
Yeah, I'm trying to think of one specifically. So one of my clients was chronically experiencing homelessness. They actually are a resident downtown at an apartment. And we've been working together for about a month, and he kind of alluded to past history of substance use, but it sounded like it was not an issue. And then about a month into working together, we had a conversation, and I found out that he had relapsed, and he did not have some supports in place that he thought he would. or that he thought he did. So we got him connected to one and to like an ongoing like NA meeting in like not far from his apartment, but also on top of that, referring him to Mercy Behavioral South Side. Also, oh God, it's the Center for Subs. It's I forget the name of it.
CBCBS.
Yeah, CBCDS.
Through Western Site.
Yes,
Yeah.
yeah. So we actually, so he ended up going to, we were kind of down between those two, and he ended up going there. And as far as I know, in the last like 2 months, he's been fine. He's, he hasn't used again. He's
Remaining house.
remaining house. He's been up to date on his rent. He's been keeping up with his payments, because that was kind of the thing, was that he blew all his money.
Yeah.
And kind of got him in that trouble. But that was just the first one I could think of. I'm sure I could think of a couple other examples.
Cool.
But
Thanks.
Any other questions or any other cases that come to mind?
So I have a situation that I was referring to earlier, in that I have a tenant who I actually inherited her when I bought the property, and she's been there for 30 some years, and it's just gotten to the point where it's not sustainable, in that she's not taking care of the house. Just way too many cats. I'm on my last limb, and need to. I do feel that I'm going to move forward with an eviction, but I would love to put some opportunities in place for her, if for nothing else, but for my own comfort, and knowing that I've tried, what I can do. So a situation like that, I guess, what would be my steps? Who do I contact? I guess maybe in the follow-up email there will be some information in that from Hannah. But yeah, there's this, and so her situation is she's drinking. She won't stop drinking. She's not well physically. Has been to the hospital recently with stomach bleeding. So there are all those complications that are involved with it. Her moving out is not going to be easy for anybody. And so just in that situation, what type of are there resources available for her?
So when it comes to the cats, we'll tackle that part first. So I know you said there's been more cats added to the household. When you have the conversation with her, is she allowed to have one cat, or is in your lease, are they not allowed to have any pets?
The lease states 3 cats, and one had passed. That was retroactively. They had 3 cats, so I said, okay, you have 3 cats. One passed, so verbally it was okay. Now you have 2, but then one of them had kittens. Now there are 5 cats at the house.
Okay.
And then they're lying to me about them. They're lying to me about the care that the cats are getting. Cats are not spayed, neutered, things like that.
Gotcha. We run into that a lot here at the Housing Authority, with, dogs being left behind once the tenant is evicted, or we have quite a few clients with cats. So that's definitely something we're trying to gather resources on, because unfortunately, when you call the local shelters, they're at max capacity too. They don't have the ability to take on any more animals. So I'm always looking for different resources. I'm trying to think of the one that I just sent out that was an opportunity. It kind of acted as like a pet shelter if the tenant was admitted to the hospital for a period of time. That way it didn't fall to the housing provider to, get into the unit and feed the animals. So that one's the animal stuff is definitely on my radar. I wish I had a better solution for that. But I think it goes back to natural consequences as well. because, if you're saying 3 cats was allowed and now there's additional because of the kittens, it's going to require more follow up for you, which is difficult because I think everybody on this call is spread pretty thin. But it's going to require more follow up from you to make sure that you're holding her accountable in accordance to the lease.
Yeah, I am. I'm going to evict her.
Yeah,
I mean, that's my, I don't have any recourse. I can't walk into her house and steal cats off her bed.
right, right.
Yeah.
Um,
I do think, not to interrupt you, Olivia, I do, from my, what I would tell you to do, right, is that she's violating the lease. So whatever step you're going to take, that's your basis, right? Like that's what you have to go off of. So yes, super unfortunate that you have to evict her. We would ideally not like that to happen. And that's where the resources would come into play. I know I'm, just repeating everything that we're saying, but your basis is that she is violating the lease. So I think that it's hard for people to kind of even start there because it's just like, oh, well, this is a problem. Yes, but according to your lease, because you are a business owner, what do you need to do? So I think I felt like I just needed to say that.
In regards to the drinking, substance use can be very tricky because, as outsiders looking in, we can see that the person's usage is a problem. But in order for them to be successful with their drug and alcohol treatment and to get any kind of clean time, they have to want it for themselves and they have to be in that appropriate state of change. A resource that I like to give people for drugs and alcohol is Pathways to Care and Recovery. It is downtown on 3rd Street, very close to Point Park University. Pathways to Care and Recovery is very similar to Resolve, where they are 24/7, 365. They never close. They have a walk-in center downtown. Pathways to Care and Recovery is a partnership between Allegheny County and Renewal Inc. And Renewal helps decrease recidivism and helps recently discharged inmates with different things. So I try to push the Pathways to Care and Recovery route. You can always have a conversation with the client to try to gauge what stage of change they're in, or do they view their usage as a problem? And if they do, then we can certainly give them the resources necessary. But if they don't, then it goes back to what Hannah was just saying. Like, you have to keep in mind what is on the lease, and if they are violating the lease, even if there is alcohol issues involved, you still have to, hold them accountable. So
I have a question. It's not so much crisis, but I recently noticed that a tenant had put up a trampoline for her children. And when I went over and I saw it, I said, it's a liability. Anybody could walk in the yard, get on the trampoline, fall off, and get hurt. She took it as though I was telling her what her children could or could not do. And it wasn't that, it's about the liability. So she said, there's nothing in the lease that says, and she's Section 8, Allegheny County. There's nothing in the lease that says I can't have a trampoline. Can you address that?
ooh, Hannah, you might be able to take that one.
Yeah. Yeah. I feel like, right, that would be based off of what you want to do at that point, right, as a landlord. So, you know, however you would word in your lease next time, no hazardous something or other, right? Something. Off the top of my head, I don't know how you would word it. But, you know, I would, as a landlord, right? I would just make it clear whenever you are talking to your tenants, which we want to encourage good communication, good and clear communication, is just stating, I'm not trying to tell you how to parent by any means, right? And maybe Olivia, you could elaborate here. I'm not trying to tell you how to parent by any means. I'm talking about safety. I'm strictly referring to the fact that I don't want you to get hurt on my property, um,
Or
and
in
where you live, period.
go in the
Right?
yard and just jump on there. Somebody else could have just opened the gate,
Right.
go in, somebody, the neighbors, kids, whatever, jump on, get hurt.
Right.
And it wasn't, so.
Right.
But does I mentioned that you're adding something to the property that wasn't there before.
Right.
But I didn't know if Section 8 has anything about them adding things. Like my lease says you can't paint and all this, but um, I just never had anybody add a big trampoline with a rod around it, that took up half the property and it was crooked. So, but
Yeah. Yeah, I think that is definitely between tenant landlord, more leaning. We do not have any verbiage in there that you wouldn't add. That would be specifically something that you would put in your lease.
okay.
Which is something that we learn every day, right? We
Yes.
have, I'm sure so many, of you could attest to this, right? We learn from our mistakes, and your next lease draw up that you're going to make for 2026 for everybody is, you're adding 10 different things, right? Because you learned from 2025. So I think that that's something to definitely keep in mind. Um, but we unfortunately do not. That's more landlord tenant specific for sure.
On a good note, though, because I said it to her, and I guess the way I said it, she said, "Well, you and I have never had a problem, and all the time I've been here, and because you're requesting that I do this, I will do it, because I respect you." Thankfully, that was the end of the conversation, and she said she would take it down. But when she said, "Well, there's nothing in the lease that says I can't add it," that that kind of threw me,
Sure.
and wasn't sure what Section 8 would say about people adding things to properties. But okay, but it ended well, thankfully.
Yeah, I was gonna say that's a win. I would say
That
that
is
that's
a
a win
win.
for sure.
Absolutely.
Yeah, and that really is, not to repeat myself, but that's definitely something that we want to preach here. We of course want you guys to maintain that good relationship with these residents. So any way that you can end a conversation like that is a total W in my opinion, for sure. We've got a few more minutes left. Any other questions, specifically maybe to any resources that would be helpful to come from Olivia and James and their team?
I'd like to offer a resource, and this is kind of unrelated. So I'm only going to take a moment, but a lot of these tenant landlord issues can be addressed in a group called Acre of Pittsburgh. If anybody's familiar with Acre of Pittsburgh, I know ACHA is part of it. But any housing providers that are looking for some more support in their community, I do recommend you check out Acre of Pittsburgh, the active community of real estate investors, real estate entrepreneurs. Great group. Strongly recommend it. Lots of resources.
Cool, thanks. Yeah, I think a lot of our landlords are definitely part of Acre, and that's a great uh that's a great additive. Sarah requests, please put the tenant's whole name in the subject instead of initials. I'm not sure I know what that means. Sarah, maybe you can elaborate. I don't know if you're still on here or not. Yeah, Maddie will definitely be sending out follow-ups and stuff like that. Any other questions? If not, we will go ahead and thank you both very, very much for being on here, Olivia and James. This was super helpful. And we will definitely follow up with some stuff here. Olivia, I'll wait for you to send me some stuff, and then I have Olivia and James's contact info coming in the follow-up email as well. So we'll be sure to do that. And then of course, whenever CBCM and the whole team is taking referrals again, we will definitely make sure to let you all know about that as well. Okay?
Thanks for having us.
Yeah,
Thank
for
you.
sure. Thank you guys very much. We'll talk to you guys soon.
Bye now.
Bye.